When it comes to stroke, time is brain. That's because there's a small window of opportunity after symptoms begin for treatment to be effective. The man you're about to meet knows this all too well. He was in a coma from a massive stroke, but thanks to state-of-the-art technology at Mayo Clinic that allows doctors to work inside the vessels of the brain without surgery, this man survived.
We were married April 23rd, 1947. I only knew him for 17 days, and he had to go back.
61 years later, Rena was afraid their long romance together was over.
Yeah, I was standing right here when I had the stroke.
He couldn't speak. Left arm was hanging down, and his eyelid and his mouth was drooped.
He had a clot in an artery at the very back of his brain.
Dr. Brian Chong says the clot was in a part of the brain that controls basic functions like your heartbeat or breathing.
Once you present with a stroke in this artery and you progress to coma, there's a 90% chance of dying.
Since Bob got to the ER within 3 hours after symptoms started, Dr. Chong could administer a clot-busting drug called TPA directly into Bob's artery. It worked. The clot dissolved, but in its place was another problem.
We saw an area of very, very tight narrowing in the artery.
To open that artery, Dr. Chong performed an angioplasty. Feeding a catheter from Bob's groin up to the narrowed artery in his brain, he inflated a balloon, opening the artery and restoring blood flow. Later, Dr. Chong placed a stent to keep the artery open. And after being close to death, Bob's long romance with Rena continues.
He's the same man, and he had the most beautiful smile, and he still has. And his eyes twinkle.
Mr. Kane was very lucky. He survived his stroke because his family called 911 and emergency services got him to a hospital that's a certified stroke center. Only at these centers are physicians like Dr. Chong able to perform these life-saving procedures. For Medical Edge, I'm Vivien Williams.